Hello friends, my name is Shivkumar Swami. My topic is drug prescribing in pregnancy. Introduction of this topic is drugs during pregnancy, which are classified into the drugs which affect the mother and drugs which affect the developing fetus. Drugs which affect the mother are therapeutic and non-therapeutic, and drugs which affect the developing fetus are not usually desired, means which have adverse effect to the fetus. US FDA categorization of drugs for use in pregnancy are categorized into 5 types. The first category is category A, and second category is category B, and the third is category C, and the fourth is category D, and last category is X. Then we will discuss the first is category A, which has no risk. And adequate studies in pregnant women have failed to demonstrate the risk of the fetus. Means these A category drugs are safe in pregnancy if given in the therapeutic doses. The examples of this category A are injection of magnesium sulfate and thyroxine. The second category is B, which has no evidence of risk in humans. Either adequate human studies are lacking, but the studies have failed to demonstrate a risk to the fetus. Means all studies are safe in humans, but animal studies have shown an adverse effect to the fetus. Examples of this category B are penicillin V, amoxicillin, erythromycin, paracetamol, and lidocaine. The third category is C. The risk cannot be ruled out. No adequate studies in pregnant women. The third category of drug is category C. Risk cannot be ruled out. No adequate studies in pregnant women, and animal studies are lacking or have shown adverse effect on the fetus. But potential benefit may warrant use of the drug in pregnant women despite the potential risks. Means most animal studies it is teratogenic. Few studies done in human is safe, but studies are inadequate. Examples of this category are morphine, codeine, atropine, and corticosteroids. The fourth category is category D. Benefit may outweigh the potential risk. Mean benefit is more than the risk of the drug. There is evidence of human fetal risk, but the potential benefits from use of the drug may be acceptable despite of the potential risk. Means the risk in human is less and benefit is more of the drug. Examples of the category are aspirin, phenytoin, valproate, lorazepam, and methotrexate. The last category of the drug is category X, which are contraindicated. Studies in animals or humans have demonstrated fetal abnormalities, and potential risk clearly outweigh the possible benefits. Means risk is more than the benefit. Examples of the drugs in this category are estrogen, isotretinoin, thalidomide. Effect on the developing fetus. Teratogen. Teratos means monster. Teratogen is an agent that causes the abnormality to the fetus when exposed during the pregnancy. Teratogenicity. It is the capacity of the drug to cause the fetal abnormalities when administered to a pregnant woman. The first example of teratogenicity is thalidomide tragedy, which occurred in Europe. The thalidomide drug prescribing to the pregnant lady suffering from morning sickness. Child born to them had deformed limbs, is called as phocomelia, so that the drug is withdrawn from the market. The next example of teratogenicity is fetal warfarin syndrome. The symptoms are nasal hypoplasia, skeletal abnormality, deafness. The next example of teratogenicity is fetal hydantoin syndrome, which is caused by the drug phenytoin. The symptoms are upturned nose, mid-facial hypoplasia, long upper lip with thin vermicular border, and cleft lip. The next example of teratogenicity is fetal alcohol syndrome, which is caused due to the consumption of alcohol during pregnancy. The symptoms are low nasal breath, epicanthal folds, short pulmonary pressures, thin upper lip. Principles of prescribing during pregnancy. Where possible, use non-drug therapy. Prescribe the drugs when only definitely needed. Choose the drug having the best safety record over time. Avoid newer drugs unless safety is clearly established. Over-the-counter drugs cannot be assumed to be safe. As far as possible, avoid medication in the initial 10 weeks of gestation. Use the lowest effective dose. Use the drugs for the shortest period necessary. If possible, give the drugs intermittently. Prescribing in pregnancy, what to avoid and what to prescribe. Antibiotics avoid during pregnancy are ondansetron, domperidone. Safer antibiotics are metoclopramide, promethazine. Peptic ulcer, during peptic ulcer, cimetidine and lansoprazole drugs are avoided, and the safer drugs used for peptic ulcer during pregnancy are ranitidine and pantoprazole. Analgesic avoid during pregnancy are aspirin, NSAIDs, morphine, and safer drugs are paracetamol and ibuprofen. Anti-emetic avoid during pregnancy are albendazole, and the safer anti-emetic used during pregnancy are piperazine and nicotinamide. Antihypertensive avoid during pregnancy are ACE inhibitors, angiotensin antagonists, and safer antihypertensive used are methyl dopa and beta blocker. Antidiabetic avoid during pregnancy are sulfonylureas and metformin. Antidiabetic safer used during pregnancy are insulin. Anticoagulant avoid during pregnancy are warfarin, and the safer anticoagulant used are heparin. Topic related MCQs. First, which category of drug is considered safe for use during pregnancy? The first option is category A, second is category B, and third is category C, and fourth is category D. The answer of this question is category A. Second, which category of drugs is considered potentially harmful during pregnancy? The first option is category A, second is category B, and third is category C, and fourth is category D. The answer of this question is category D. The category D is harmful during pregnancy. Which of the following drug is commonly used to treat hypertension during pregnancy? The first option is linsopril, second is amlodipine, third is metoprolol, fourth is propanolol. The answer of the question is amlodipine. 4. Which of the following drugs should be avoided during the third trimester of pregnancy due to the risk of premature closure of the ductus arteriosus in the fetus? The first option is ibuprofen, second is acetaminophen, third is aspirin, and fourth is endomethacin. Answer of the question is D, endomethacin. 5th, which of the following drugs should be avoided during pregnancy due to risk of fetal harm? The first option is folic acid, second is vitamin D, third is warfarin, and fourth is iron supplements. The answer of this question is warfarin.